Good afternoon, everybody, and welcome to the Sustainability Day campaign webinar. We're glad you all could join us this afternoon. We're going to be discussing the WELL building standard. The webinar is titled Healthy Buildings Leading to Healthy Lives, and we're delighted that we have the webinar sponsored by the team at Cundall. This webinar, if you don't already know, will be addressing the role of WELL certification for buildings. As you know or may not know, the WELL building standard takes a holistic approach to health in the built environment, addressing behaviour, operations and design, providing the opportunity to design and build with a human-centred approach which ultimately supports the industry in comprehensively addressing human health. Employers are spending 90% of their annual operating costs on people, staff in the buildings, whether it's reception, frontline, back office, wherever it may be. This means that even a small impact on productivity, engagement and satisfaction in the workplace can have a huge return on investment. This is particularly true of the NHS, where better buildings can lead to quicker recovery times and make substantial improvement in achieving a sustainable workplace in healthcare. Equally important, many people are referred to hospitals because of respiratory infections. As a result, poor accommodation and reducing demand on secondary care is of key importance. It's all about prevention, as we know, so looking at well-being in housing, looking at buildings is very important for the future of the NHS and healthcare moving forward. So today's webinar is going to look at some issues including why choose the WELL standard, how the WELL can improve your building, business case for WELL, and how to achieve the WELL standard and certification. And we're delighted to have two speakers on hand today. The first is Seema Wadhwa, who's a faculty member of the WELL Building Institute and Assistant Vice President of Sustainability and Wellness for Inova Health Systems. Seema embraces health and wellness as core drivers for sustainability. She has used these values to oversee strategic planning and management of sustainability and wellness. Her efforts have demonstrated multi-million-dollar savings and measurable impacts. Seema influenced the national conversation on sustainability in healthcare while leading the Healthier Hospitals initiative from launch to over 1,300 hospitals enrolled across the nation. She has a passion for sharing knowledge and co-authored the first book for leadership in the field of healthcare sustainability. Our next speaker is Paul Chatwin, Associate at Cundall. Paul is a chartered building services engineer. He has worked in the construction industry for over 25 years. As an engineer, Paul is passionate about providing low-energy service designs that have a positive impact on health and well-being while considering natural resources. For the past 10 years, Paul has focused on environmental sustainable design. He's a BREEAM and WELL accredited professional. Thank you to you both for joining us today and being our speakers. So without any further ado, we're going to pass it over to Seema, who will be our first speaker. We have got some questions at the end of the session, and Matthew will be letting people know if you kind of click and want to raise a question, send that across, and I will be putting some questions we've had in already at the end of this, but I will hand over to Seema, who will begin her presentation now. Thank you very much.
Good morning, or at least good morning from my end, as I'm calling from the United States. Thank you so much for inviting me to participate in today's conversation to celebrate Sustainability Day. So as we get into the WELL standard, I wanted to start today's conversation looking as to why this is a key opportunity and specifically relevant to the healthcare industry. As was mentioned, I work for Inova Health System, and for those of you, many of you who may not be familiar with Inova, Inova is a 5-hospital health system located in the Washington, D.C. metro area in the U.S. Inova comprises of 5 hospitals and a multitude of off-site clinics, in the order of around 200 clinics and offices. I have been working with Inova since 2008 in leading their sustainability efforts, and I'm excited to share some of the journey that I have seen through the eyes of Inova and through some of my work on a national scale as to how we're shifting more towards a focus on wellness. And I think that shift really starts on a larger social level when we look at culturally our viewpoint towards the environment. Historically, when we look at our viewpoint towards the environment, it has been more of a question of what impact are we as a society having on our environment. That may include what impact are we having on our waters, what impact are we having on our air quality, and how are we degrading our forests. However, there has been a fundamental shift, and that shift has been the evolution of what impact is the environment having on our health. When we look at this question from the other lens, we start to have a very unique position for the healthcare industry, and that is a question that is centered around health and healthcare. So with this reframed issue and turning the conversation around, it presents a very unique opportunity in the healthcare industry. We have stopped and really looked at the impacts that the healthcare industry is having on the environment and really questioning how we are really supporting health as part of our mission. I'd like to share a video highlighting a little bit of this unique positioning. And so bear with me for 1 second.
I began my career by swearing my allegiance to the Hippocratic Oath. As a pediatrician, I was so proud to be part of the tradition of the ancient doctors who swore, in the same spirit as we do today, to treat the sick and protect them from injustice, and above all, to first do no harm. Since the time of Hippocrates, medicine has evolved in unimaginable ways. Inside our clinics, we've become brilliant at treating our patients' symptoms. But outside our walls, some of these illnesses are growing to epidemic proportions. Of course, we ask ourselves, what is making people sick in the first place? And why do they keep coming back? In our journey to diagnose and treat the body, we've been to the moon and back many times over, masters and explorers of the very small. But 20 years ago, some of us saw that to understand the problem, we had to take a wider view. From that vantage point, we saw thermometers, each containing enough mercury to poison an entire lake, piled up in our trash. From an even wider lens, we saw medical waste incinerators on our own properties throwing toxic fumes skyward. Dioxins and mercury from waste incineration fell to earth, entering the water we drink and the fish and animals we eat, poisoning our bodies and the developing brains of our children. Our own fingerprints were all over the scene. We were contributing to making our own patients sick, all in direct violation of the oath we had sworn to do no harm. So we formed a coalition of doctors, nurses, and advocates to push back and push healthcare to stand with our oath and clean up our own house. Today, only a handful of incinerators exist in the U.S., and mercury thermometers are going the way of the horse and buggy all around the world. But while you listen to me, the climate is changing, and the people we serve face perhaps the biggest harm of all. Now we need healthcare to be a leader within this widest scope. Look at healthcare's global footprint. We consume huge amounts of energy on every continent, contributing to climate change and air pollution that kills 7 million people a year. In the U.S. alone, healthcare is responsible for 8% of greenhouse gas emissions. But here's our leverage. We are 18% of the U.S. economy and 10% of the entire global economy. The changes we make really can move entire industries away from harm and set new norms that will positively impact our patients' health. Imagine, for instance, if healthcare fought antibiotic resistance by purchasing only antibiotic-free meat, or how innovative solutions to eliminating waste, like biodigestion, could help power hospitals and reduce air pollution around the world. Healthcare could help make renewable energy viable. By choosing to turn away from fossil fuel, we would reduce the carbon emissions that harm our patients and our planet. We stand at a turning point in the course of medical history, and we can move to a tipping point. It's within our power and our mission. Dr. Martin Luther King said the moral arc of the universe bends toward justice. Join us as healthcare bends toward a more just and sustainable future, rooted in our original oath, do no harm.
So hopefully this video helps highlight some of the shift that's been happening in the healthcare arena. With this shift, we have gone from looking at that sustainability to now that focus of wellness. How do we keep people well? And when looking at how to keep people well, it is an all-encompassing discussion knitting together sustainability, health, and wellness. Looking at the evolution within Inova as an example of a health system, when we started our sustainability journey, it started with a focus on operations, managing our own footprint. That included areas such as energy, water, waste, sustainable food, alternative transportation, green construction, and environmentally preferable purchasing. From there has been a progression towards looking at supporting health. So looking beyond the operational areas to include strategic planning and stakeholder engagement. So how are we incorporating sustainability as part of the larger strategy of a health system? And then beyond that, how are we engaging key stakeholders internally and externally as part of the conversation? And that really allows a platform to look beyond not keeping the environment healthy to really improving the health of all of our populations. And that helps bring us to this intersection of well and green building. The well building standard is a standard that is focused on people, and that focus on people is pulled together with looking at the built environment. How is the environment keeping us well? And this is a growing opportunity from looking at LEAD, where we're looking at where the focus was on reducing our impact on the environment, and as a continuum of that conversation. Both the WELL standard and the LEAD standard do have a lot of synergies. The WELL standard provides a model for design and construction to integrate human health features into the built environment. So when we look back at how do we define well and wellness, it is a complicated question, and then putting that into the nature of the built environment, what was done was looking at key elements within the built environment that could help support human health and developing a standard that could support that for replication and scalability. WELL is a performance-based system, and it's able to measure the impact of the environment on human health. And as a healthcare industry, again with that mission on first doing no harm, it is an opportunity to take the value and the key imperative to first do no harm and put it into practice as well. There are 7 key concepts within the WELL building standard that really allow us to look at total health. They include air, water, nourishment, light, fitness, comfort, and mind. And I'm going to turn it over so that we can go through each of these in greater detail. Information is here for any further follow-up questions. And I will pass it on.
Thank you very much, Seema. Thank you very much for that presentation. I think it was fantastic to get an understanding of what you've been doing and some of the work you've got there. If there is any questions, we will take them at the end, because I have already had 4 or 5 questions emailed into me that I've got ready for both of you. But if there is any questions that are coming, we can flag them up. I'll just check on the chat section to see if anyone is waving their hand, so to speak. What we're going to do now is we're going to pass over to Paul Chatwin. from Cundall, who's going to talk about the work they're doing and some of the examples possibly in the UK and some of the stuff they're doing there. So over to you, Paul.
Thank you, and thank you, Seema. That was a really good presentation. My role and what I'm going to be discussing and talking with you today is going to be around how we in the industry have been looking at well-being and applying it to various projects. Just a little background, we are a multidisciplinary consultants advising construction professionals, and our core services are the building services, civil, structural and sustainable design. And sustainable design has always been a key part of what we offer. With various specialisms like the lighting design, this also does, and the acoustic engineering, have quite a key impact to influencing the internal environment and making those spaces well compliant and just productive places. We are across the globe as well, and this also helps us with differing views, differing opinions in where you are seated, I suppose. We've got 4 well-accredited professionals, and I'm one of them. And one of my colleagues in Hong Kong I was chatting to this morning in preparation for this was giving me her viewpoints on some of the aspects. And there are cultural aspects that will influence various credits. For instance, trying to achieve the best daylight or the best artificial light or daylight in a space. That can be influenced by the building and the glazing. In the Far East there may be more tendencies for solar control glass that prevents that daylight coming into the space. With one of the case studies I'll be talking about earlier, we managed to achieve the lighting requirements through artificial light and not being reliant on the artificial light, through making sure the natural light achieved the requirements. But we know, and some of this has already been covered by Seema, the whole reason that we are interested in this at the moment is because we spend so much of our time indoors. And we also know as a business, and looking at various businesses throughout the world, sick days, of which primarily these are flus, colds, which may be exchanged from person to person, the air conditioning systems, for instance, and also for backaches that may be due to poor furniture in the workplace. Those are probably the 2 key reasons why we lose sick days. So if we can avoid sick days, then that's going to obviously benefit the people. So from the NHS estates perspective, this is more to do with the staff working in their environment and making sure that the environment is good for them. And we also know that pollution outside, pollution externally, can be detrimental where the hospitals are located. If they're in rural locations, then the air quality outside might not be so bad, so you can have more open to natural ventilation, which will have lower energy consumptions, lower carbon footprints and the like. But in city centres, what do you do when you've got air pollution issues outside? And what well-being and the well-building standards are looking for is to make sure you provide that air to the right quality. You test the air and you make sure it's okay. And this is not just health estates. These are just 3 documents that have come out very recently. UK Green Building Council supported, or World Green Building Council supported, of which we, Cundall, are members of, are looking at various ways that these well-being features, the well-building features, can be applied to good practice standards and codes going forwards. So there's a trend, there's a definite trend towards the healthy buildings. It's not that sustainability and climate change isn't important anymore, it's just that we are more, the profile of healthy buildings is being raised. I was giving this presentation, or a similar presentation, to a lighting manufacturer yesterday, and talking about the influences that light, artificial or natural light, has on our body clocks, our circadian rhythms. And there's all sorts of lighting that you can get now with tunable white or human-centric lighting. And they've been saying, we've been talking about this for 10 years. It's nice now that the industry is taking more interest in health and well-being. So there's technological advances can help, but there's also just the general interest. So I'm going to talk you through 3 case studies because I think our experience over the past 2 years with the well building standard and well-being as a general topic, it's interesting to know not just what the manual says, but how that actually applies in reality. So there's 3 case studies. The first on the top right will be our offices in London. We moved in almost 12 months ago, so we looked at post-occupancy evaluation, we've looked at absentees, and we've got some numbers towards the end to see how that has influenced productivity. And then the case study on the left is the UK Green Building Council, where we are working in competition. We won with Bar Gazettas as an architectural practice to fit out a relatively small office environment. And then the bottom right is the third case study, which is Better Sea Hangar, which is a more larger site which wants to be one of the UK's leading sustainable, low energy and also wellness considerations applied to that project, which is in design at the moment. So moving straight into the One Carter Lane case study. This is near St Paul's Cathedral, near the Thames in London, and as I say, we fitted it out and moved in about 12 months ago. And last week it finally was certified with Gold WELL standard. So this was the first building to be certified in Europe, and to achieve a Gold was something that we were quite proud of. We also looked at other sustainability rating tools. The WELL is very much the human-centric tool, whereas BREEAM and SCAR are much more relating to sustainability, which we mustn't forget with all of this. Although we want to make sure we deliver a nice environment for visitors, for staff, for patients, we must also consider the sustainability, the energy consumption and the like. So taking those 7 sections of the well building standard and just talking through some of the details, air is one of the largest sections of the manual, and it's all about the air that we breathe in a space and making sure that it's to the right level of air quality standards, whether it's to do with the filtration levels, the PMs 2.5s and the PM10s, as well as carbon monoxide and other elements. And what is key in trying to apply this in practice is making sure that the materials we specify. So with our office fit out, we provided a recycled plastic bowl-on flooring, which had a slight uplifting cost. Some of the furniture was from bespoke joineries, local joineries, which again is a good thing to do, making sure that we were getting products that go into the fit-out that have low VOCs, low volatile organic compounds. This was probably the most scariest part of the test, that we didn't know if we were going to pass or fail until you carry out that air test. So natural materials is key. But also the paints and the adhesives are important, and you've got to make sure the paint is dry and the adhesives are cured before you put in certain elements that might reabsorb those new kind of car smell, those emissions that you get from new products from manufacture, which can take a long time to release, 12 months or so. And with the contractor they were employed, they knew we were going for the well building standard, they knew it was going to be new to all of us, so we were policing them quite heavily. And one particular colleague in London, they were going around making sure that the paint was compliant, making sure the adhesives were compliant, and the contractor came out with the great, okay, if I can drink the paint, then it's okay to put it on the walls. So we test, because fundamentally, if you don't test, you don't know. And that is a big part of the well building standard for both air and the water, is you test. And we test it against all of these requirements and the well standards that are shown there on the slide. And the VOCs, these volatile organic compounds, were the one that we were most unsure about. And we told the contractor, right, we're testing today. Don't come into the building today. We're close to handing it over and occupying the space. And the guy came in, he put out his testing equipment, and he said, there's no new car smell, you'll be fine here. And came back 8 hours later, collected equipment, ran the results, and we failed with the VOCs. And what transpired was the landlord had been in during that time to do a clean, and it was the cleaning products that was being used that were off gas. And this is part of the well manual, that the tenant and the landlord, if he's carrying out the cleaning, has to make sure that his cleaning products are friendly to the environment as well, as far as their emissions. And we retested the following week, and it was negligible, so we were all happy in the end. The water has to be tested. There are about 20 items that you test. We know that water in the UK is of a high standard, and in various other places of the world as well, it's at a high standard. but how do you know it's safe unless you test? We know it's safe when it leaves the water authorities' places, but between them and consumption, you could have influences from the ground, from pipe work that may be fractured in places. So unless you test, you don't know. And the water authorities will add fluoride, they'll add chlorine to clean the system to help with health, but too much fluoride leads to fluorosis and mottling of the teeth. Too much chloride will lead to chloramine and other nasties. So you have to test, as well as mercury, lead, arsenic, and a whole list of other things that you have to test for. And the result was that we had to put a water filter in order to meet the well building compliance standards in this particular case.
Can I just ask, Paul, is that you in that picture there? Is that who is that person?
It's if you took the beard off, that would be me. It's the I've had that before. The illustration is made to say it's a man-sized beast. It was 7,000 pounds for this. The light section is the next section in the well manual, and with a decent new lighting design you will comply, but you have to know what is required, and there are elements in the well building standard about artificial lighting and glare, but yeah, if you consider these things you'll be okay. There are items around various credits that you can choose by influence the fabric, the amount of window, and how the window shaded for glare control all comes under it. But the big issue here is this body clock, this circadian rhythm that we need to maintain for optimum health, and it's making sure that the light level, which is typically a teal blue kind of light level, is the right level that falls onto our face as we sit in our workplaces. A lot of this is around the work sector, and I appreciate this is to the hospitals and health estates guys out there, but if you just imagine your own workplaces, and this will apply to various other elements of the hospital as well, you can imagine. If you get the right light level stimuli during the daytime when you occupy that space, and it releases the right chemicals in the brain for alertness, then at night time you will sleep better. And this is science about our body clocks. We chose a Bolon floor, a recycled plastic floor, to make sure it was more of a healthy material rather than a carpet, easier to clean and the like, and we knew the volatile organic compounds would be okay from manufacturer's data. But it also had an added benefit just by the reflectivity. The lighter colour compared to most carpets just gave a great light and feel to the space. The next section in the manual is nourishment and food, and with our office we provide typically fruit. We don't have a catering facility, but if you have a catering facility there's a lot of requirements around making sure the quality of the food's right, that there's not too many added sugars. There's a lot of detail providing a salad bar in the manual, and it's mainly because we're not just looking at physical products, but we're also looking at raising people's awareness with well-being where we can. So there's a lot of the manual is to do with raising people's awareness with food choices, having food labelled. But for our office it was preventing contamination, so the spout width and height of the width of the sink and the spout height has to meet certain requirements. Paper towels need to be provided because although hand dryers may be deemed to be more efficient because they less energy or less contact, it's actually I understand the wiping of the hands which can also influence how well they're cleaned. And fruit and veg, providing 2 types of fruit and 2 types of veg. Fitness is another section of the manual, and again this is about how can we design buildings to actually influence people's activity, try to reduce the sedentarianism and the seated position and this lower backache that people tend to develop and may be the cause of absenteeism and lost sick days. So there is, in our particular case, we provide yoga classes, and there are other elements in our HR policies around tax incentives on cycle schemes, and it's making sure that if you want this well-being, if you want to apply this standard to your project, to your workplace, then you need to really bring in HR and make sure the HR policies are met. Moving on to comfort, sit-stand desks are, when there's been various surveys done over the office workplace, and there was one where 1,000 people provided some questionnaire data, there was a large portion of people that did actually want the ability to sit or stand in their workplace, and again this will help with health. and having the desks height adjustable, having the screen height adjustable, having the seats adjustable is things that need to be considered. And then we talk about mental well-being and mental health, and how do we influence the environment for mental well-being. And there are requirements in the manual for a virtual library or a real library about subscriptions to health journals. So again, this is influencing and just raising awareness with people, as well as the physical side of things being you have to have features for beauty in your design, you have to have features for biophilia in your design, and this is our connection, our human connection with outdoors. And it doesn't necessarily mean plants, because plants in a healthcare establishment, they have their other elements that they may attract, not so much the picture of a mouse and vermin, but flies and the like. So you don't necessarily have to have plants. There's a moss image there, and you can even have moss boards that you put on the wall. You can have moss integrated with light fittings I saw yesterday, and it's a very tactile thing, and it does influence people's mental well-being, just having that kind of stimuli. The next case study is the Battersea Hangar Visitor Centre, and this is a project that we've been commissioned with on many different counts. So it's looking to be one of the UK's most sustainable buildings, and it's not only looking to design to comply with the WELL building standard, but it's also looking for things like BREEAM excellence and to become a zero carbon and A+ energy performance certificate. So we are working as a wider scheme on this, and we're looking at detailed design. We're looking at passive house design principles to reduce energy consumption. We're looking at master planning. But really, for this project, it is an old coal mine. It is an old colliery. So to the left is the pit head, and to the right on the image is the actual coal mine surrounding areas itself. And they're trying to show how a polluted environment, which was once a bad thing, is now becoming a good thing and a zero carbon, and looking at cycling facilities to be provided to encourage people's health and well-being, the material selections on the buildings. The food is also one of the big elements here, is they're looking for areas of allotments so they can cater with healthy diets on the site. There was a bit of a concern over the air quality of the site, being an old disused mine. But once you test, we knew that it was fine. There was no elements or issues with that. Moving on to the final case study. This is of particular interest because it's the UK Green Building Council's headquarters in London. And they decided that they not necessarily wanted to apply the WELL building standard, but they wanted to look at the features that were important to them. They were on a limited budget, and they wanted to embrace low carbon design and low carbon as far as embodied energy and embodied in the material selection, so they recycle some of the glass. But they're also in a polluted environment externally, so they wanted to bring the air in and look at the way that the use of the plants and circulating air within the space can actually clean the air and remove some of these volatile organic compounds. So there was a lot of work that we did with the UK Green Building Council to make sure that the furniture, the stuff that was provided in the space is well compliant in certain areas that were important to the UK Green Building Council, and materials and embodied carbon being the main one. They had a carpet, rather than going with the recycled plastic, but this carpet has certain features for dust collection and doesn't then release that dust back into the space. Because again, in the external environment, it can be polluted with the filtration levels. The PM 2.5s and 10s can be influenced via brake dust, not necessarily what comes out the back of a vehicle. So what is the cost for all of this? Because I believe the health estates are on a bit of a tight budget, and there's massive pressures across health estates to not only reduce carbon, reduce energy, and now we're adding this extra one, and why not provide a healthy environment? And as demonstrated by Seema, it's so important that not only in the workplace but in other elements of hospitals, and not necessarily hospitals but outside in people's homes and stuff like this, if you can have a healthy building, then it's going to be less burden to the NHS. The cost that we experienced is illustrated on this slide, and the crux of it is it wasn't a large cost to a professional organisation. The payback period, which is on the next slide, is quite quick. And there's some items in there that hopefully you wouldn't have to provide if the water quality in your area is good. You wouldn't need the £7,000 for a water filter. We had to put in variable air volume to the meeting room, so any rooms that are over a certain threshold for densely occupied, you've got to make sure you're providing the right amount of air to those people. But most good practice designs would include those features. But if you're looking at a refurbishment, then you might need to be looking at your air handling plans and how you actually apply that feature to reduce the air or to provide the right amount of air to that space. And then costs can be different in, for different cases. We've been looking with our own HR data to try to understand this, because frequently we're asked about the metric, about the payback period. When I'm presenting to quantity surveyors and clients, the money side of it is always the main interest. And we have got limited data based on our own experience. We were the first building to be certified in Europe, so there's not many buildings that are certified. We've registered half to a third of all the buildings that have been registered in the UK to date. So this is there's a lot of interest in the well building standard, and it is gaining traction, but just well-being in general is a good thing. The graph illustrates that the staff levels have remained pretty constant for our London office, but the absenteeism has been on a gradual reduction over that 8-month period. And you could say, well, there's lots of other political influences, maybe Brexit and maybe a slight downturn in workload may mean that people don't move as much, but this is just purely the absenteeism data. And we've also looked at various other offices. We've refurbished and moved locations in various of our offices. So we've then gone back and looked at, well, how did it influence that office and how did it influence that office, which was refurbished, because people like a new office and it might not be because it's well building. So we're trying to work out what was the difference between a newly fitted out office being nice and a newly fitted out office which was a well building standard. And there was about a 27% difference between those. So again, the paybacks within 2 or 3 months can be easily achieved, we feel, when applying the extra uplift in capital cost. The payback is just quick, we feel. So finally, just the last few slides now, what are the key considerations for you as clients or for you in the estates when applying these healthy well buildings? Again, I've mentioned this before, it's bringing in the human resources department to look at the human resources side of things, how we can influence health and well-being. Looking at beauty and biophilia, and this one is a tough one with health estates because you may not, may be reluctant in certain areas to bring plants and greenery, but you can do this via shapes, patterns, materials. And we've done some studies. This is important to us. We know various plants have various health benefits, not only on the oxygen they provide, but also on the soils. And this is a device we've got in our London office, which we're tinkering, we're engineers, but it's a way of getting the soil exposed to this way, because it's the soil that actually strips out some of the VOCs. So we've got a water bath in the bottom, there's a fan to the back of that unit, and it circulates room air. The air and the water test rarely happens in practice, and this is one thing that's nice with the well building standards. It sets limits, it sets the designs, and if you don't test, you just simply don't know. And this is the last slide. This is important to us. We didn't go down necessarily the BREEAM route, but we were the first organisation to be endorsed by Bioregional for One Planet Living principles. Those One Planet Living principles is what is the backbone to us as a business, and it's what we apply based on our research and to our own staff. And health and happiness is up there as one of the top ones. So thank you.
Thanks very much, Paul. A fantastic presentation, very detailed, great to touch on the costs, great case study on the Bertsinger Visitor Centre, and the part you made about the body clock and the sleep has been well documented this week, actually, recently on the BBC News about the cost to the economy for people through illness, through tiredness. I've got some quick questions that I want to put over to you both. I'm going to start with the following. From a public health point, how can we support our planning and transport colleagues to consider the key elements of this standard with their developers and contractors? Basically, how are we getting estate directors to speak to their supply chain, for instance, to understand that the health benefits when putting together a building? How do we influence people to take this up? The cost obviously is a big thing, but what can we do to generate interest in order to look at this as a thing to move forward from a state director or a supply chain provider?
So this is Seema. I think that, as you know, as I highlighted, for the healthcare industry, there is a unique starting point of that conversation that's probably a little bit different than many other industries, and that's, you know, looking back to that Hippocratic oath to first do no harm. So absolutely there is a financial consideration. However, when you deep dive, as was really well done in Paul's presentation, into all of the elements and the impacts they have, and feeding back to the mission of why we do this work, it is an opportunity to shift that conversation. You know, I can say when having similar conversations within organizations I've worked with and within Inova, you know, once that conversation goes back to why this is important and why this is part of our mission, it takes on a different light. So that's been helpful in my experience. And, you know, of course, having examples highlighting some of those cost savings is key. And my role currently reports into HR, which is unique. I've reported to multiple places within the organization, but also finding allies to help support that conversation as to some of the co-benefits for the organization is another place to engage.
Right. Paul, I'm going to come to you on a different question. Thanks for that, Seema. I'm going to ask you a question that we've had in from Alistair Key, and that is one of our webinar attendees today, and he says, how can passive house be applied to healthcare buildings? So how does it sit within the Bremen passive house in terms of the broader sustainability standards?
Yeah, it's always horses for courses. Passive house works great on the climate. It works great for that particular element where you've got a heat only. So looking at the energy side of things, if you're not air conditioning your building and you're looking purely at a heating only application, then tightening up the insulation, tightening up the air leakage through the building is a good thing because it's going to reduce your heating energy. But it doesn't mean you can't open the windows. You need to be able to open the windows so that you can have a nice environment. And we are seeing one of the big things with passive houses, the triple glazing element and the air pressure testing. But I saw an air pressure test result yesterday on a shed which was almost passive house standard. So the industry is now almost providing some of those elements. The other big one on passive house is triple glazing. Do you need to go to triple glazing in a UK climate? It will help, and it means you're more comfortable where you've got a lot of glass because of the radiance effects. But I don't know if I'm answering the question. You've got to look at passive house and only apply passive house where it's appropriate. So if you're looking at a very rural location, it's a great starting point. And once you know the cost and understand the costs, why not?
Alistair from, I think Alistair's over at Kirklees Council, but we've had a question coming from Kirklees Council, again to you probably, Paul, this one. Is there any buildings in West Yorkshire or the north which have or planned to have implement the well building standard that you know of?
I don't know, but from our experience and having registered the buildings, what we're seeing is the greatest interest is London, and when you go outside of London, there's lots of interest. I know in Birmingham, for instance, that there is a building that's looking to be registered, but further north, I'm not aware of many projects that are being implemented. So it is at that early stage of being adopted or adapted. And Bremen sustainability side was probably the same. It wasn't until it became more required through health estates, through various planning, pushing it, that it became more mainstream.
Yeah. Yeah. Well, finally, just to make everyone aware, we have got a survey currently running at the moment.
Hi, Scott.
We'll send information out.
Hi, Scott. Could I just interrupt? We've had
Hi.
we've had a question come in from Qatar. from Riaz is he wants to know is how easy is it to implement well in the existing buildings that they have already adapted?
Well,
Seema, you next one.
I was going to say we're looking at our own offices where we've actually done a fit out not long ago. Is it well compliant? And the lighting seems to be well compliant, but then the ventilation system is a landlord ventilation system, so we need to make sure it's filtered and can vary its speed to tick some of the boxes. What about the VOCs and the materials, which is one of the hardest targets? Well, test the air and see if the air is okay. If a product is 18 months old, then you don't need to have manufacturer's details. So you just need to be wary of what you brought recently into that environment and what certification that has for the air, the VOC, the low VOC levels. That's probably one of the main issues. Yeah, you need to start with the manual and go through a pre-assessment and have a look.
Seema, can you add to that, or do you want to add to that?
I would say that one of the things that lends well, no pun intended, for the healthcare industry in terms of achieving the WELL building standard is part of the design that's inherent in healthcare, such as being cognizant of low VOCs is already happening. Commercial spaces, because we're already building to standards with health and wellness in mind, especially with air changes, design, and considerations from the Joint Commission as well.
Right, any more, Matthew? Or
No, we've no more questions come in.
Great. Okay, well, what we'll do is I'd like to say thank you to the panelists and for everyone joining us. As I said, the survey we've got at the moment will help you to understand a little bit more about it, maybe able to understand the challenges you're facing. So Paul, Seema, and others can obviously help where possible if there's anything that you want to understand a bit further. The survey will also give us an understanding of the current landscape within the NHS and wider around this. So we will send out all registrants today the survey link, and it's very quick. It's 10 questions. If you want to fill that in, please feel free to do so. None of the information will be, the names and stuff will be shared with other survey people fill it in, so it can remain anonymous, but it's just obviously to understand a little bit more about how we can help. I think the conclusion we can take from today is that the WELL certification and WELL is something we should be embracing. Obviously the elephant in the room, as Paul touched on, was obviously the cost associated with it, but as we move towards a NHS which is heavily burdened through financial constraints and demands, we also need to be looking at a preventative system of healthcare within our communities and supporting our staff in order to make sure that they're fit and well for work. Therefore, it seems a no-brainer to embrace, but I'm sure it's not as simple as that for estate directors and those moving forward. However, I hope you've enjoyed the webinar. I hope it's provided some benefit. We will have the recording available for next week for you to look at and share, and we'll also share details for Seema and Paul to you if you want to drop them a line and get in contact. But once again, thank you for joining our webinar. The next webinar we've got is in January. I think we're looking at around about January the 18th, and we're going to be looking at financial barriers to implementing such things as this, such things as energy efficiency, but how we can overcome the financial barriers and win over the CEOs to start working on this area and providing a sustainable NHS. Thanks very much for joining us, and have a good rest of your day. Thank you very much.
Thank you.
Thank you.